Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with your educational videos about optimal health and the most innovative and holistic approach to your well-being. So today let's talk about acute and chronic knee pain and how you can find relief with natural and effective therapeutic tools. You know, I never really know what topic I will choose, and sometimes I create a Discover series which is followed by a package of videos, but most of the time I choose my topics which recently appear more than any other ailment in my practice, Medica Nova. So I thought it's a good time to make a video about knee pain and how you heal it, and hopefully you can bypass a surgery. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and family, and don't forget to have a look at my website medicanova.net at the online academy, where you will find comprehensive home study online courses in first aid homeopathy for the whole family, quantum healing and so much more. If you're interested in a personal health consultation, either for yourself or your children, contact me at health@medicanova.net. So enjoy. Next to back pain, knee pain is one of the most common complaints among both older adults as well as younger athletes. Now, knee injury are one common cause of knee pain, but you don't have to trip over, have an accident or fall over to experience knee pain. There can be many other causes, for example, arthritis, overuse, osteoporosis, certain types of exercises like running and jogging, repetitive movements are all causes of knee pain. There can be autoimmune disease like rheumatoid arthritis, which affects the overall joints in the body. But what are the symptoms? Often there's a sensitivity. You maybe have a throbbing pain. Swelling around the kneecap is very common, feels hot to touch. Discomfort, that gets worse when walking, squatting or doing other exercises. When you do yoga, asanas, and you feel like, oh my God, it really hurts. Inability to bear weight on the knee. Most of the time I see stiffness and a reduced ability to move the knee, such as having a hard time maybe straightening or bending the knee. There's weakness of the affected leg. Again, I mentioned the redness and the warmth around the kneecap, instability in generally reduced range of the motion. But sometimes I've seen that people feel like as if the knees give away when they walk as well. And then we have the unusual popping sounds and the crunching sound. So with its shallow joint surface, moon-shaped cartilages we call menisci, ligaments on each side and internal ligaments we call cruciates, the knee is highly susceptible to twisting injuries, sprains and strains. It's also subject to inflammatory joint disease, including it's called synovitis or bursitis or rheumatoid arthritis, as I mentioned. By the way, with rheumatoid arthritis, you want to have a look at your guts. Bring in more digestive enzymes, systemic enzymes, and definitely have a look at your parasites maybe. But what is bursitis? Well, bursitis is again an inflammation of the bursae, and the bursae is a small sac filled with lubricating fluid located between the tissues such as the bone, the muscle and the tendons and the skin. It's this little blob which sticks out of your kneecap. You can even move it. It has a function because it decreases the friction and the rubbing and irritation and helps the joints to move easy, but it can sort of slip out to the side. Now, synovitis, on the other hand, it's an inflammation that occurs in the tendon sheath It's the inner lining, the membrane of the joint capsules. And the membrane lines joints that possess usually a cavity, and that's why it's called synovial joint. So it's more the interior of the knee. Every time you see a name called with the end of it itis, it means it's inflammation of this affected area. Arthritis, and we talk about lots of remedies about this today in this video, which include again rheumatoid arthritis, autoimmune disease, but here we talk about osteoarthritis, which is a degenerative arthritis which usually affects older adults. But in the US, hey, we talk about 20 million who are affected, and it's one of the top 5 most disabling conditions that affects more than 1/3 of persons 65 years and older. So it is important to talk about and to share with you natural solutions. There can be other conditions like the kneecap is affected, we call it chondromalacia, or tendons attachments, repeated wear, and strain. I talked about, hey, if you're a footballer or a die-hard skier, you maybe have a torn meniscus, which is this tough rubbery cartilage. This helps absorb shock in the legs. You've talked about maybe tearing of the ACL, anterior cruciate ligament, connects the shin bone and the thigh bone. That can be very traumatic. Fractures of the patella, which is the kneecap, dislocated kneecap can happen. Even biomechanical problems where there are some deformative and the muscles have to compensate for that. And then we have gout, the uric acid accumulation or infections. But in this video, we want to keep it simple, and we really talk about more osteoarthritis remedies and just acute, easy injuries. But what are the solutions? Well, we are taught that cartilage can never regenerate itself, only scars after injury, but clinical experience and recent research shows us otherwise. If you have a good nutritional therapy, plus homeopathic remedies, which you can get hold of in your local health food store, as well as physical therapy, external applications, you can promote tissue healing and even reverse serious joint changes, helping the body to regenerate the cartilage. I've seen it. I do this for nearly 30 years in my practice, Medica Nova, so I'm really talking from experience here. Works very well. It takes time. I'm not saying this is an overnight process, but there are other solutions. But before I share that with you, I want to talk about body language today, because our symptoms in our body express really a story behind it, and which we don't want to hear, which we don't want to look at. But with knees, it has a lot to do with the ability to stand upright. And that's how it starts. I have power, I have strengths, I have independence, I can move forward, or I lose it all. With the knees, we only can walk on one plane, like forward or backwards. It's not sideways. So there's a strong polarity here, which expresses a strong yes and a strong no. It really talks about being free to move, being independent, or having to go into submission, either forced or voluntary. In the animal kingdom, if an animal, meets an opposition which is more powerful, the instinctual behavior of an animal is to go down to one's knees, make oneself smaller. Maybe I get away with that. If you look at our speech idioms, we use words quite unconsciously often, but they express something. We say, I'm on my bended knees. I'm brought down to my knees. Crawling on hands and knees. You must crawl before you can walk. We do a lot with our knees. We pledge loyalty on our knees. We pray. Some of us get even naked on one's knees, or the others get enslaved. We propose on the knee. The knee have a lot to do with pride and ego. Louise Hay talks a lot about it and says it's really also related to a stubborn ego, too much pride. It's why you are brought down to your knees. There's an inability to bend. Brings up fear, of course, and definitely inflexibility on the mental, emotional, and well as physical plane. These people have a hard time to give in, right? That's why sometimes life brings them down to their knees. So I want to invite you to really look at your body, listen, look at your life, look at your environment, the people you are engaging with. Who brings you down to your knees? Right? What is so difficult? Why are you so stiff? Ending up in arthritis. It's not just about the bad diet. What makes you rigid inside? I talked about nutritional therapy, and I think that's the first one I want to share with you here. It's very important here to introduce a nutrient-dense diet, which is important for overall joint health, but in this case the knees. It helps to maintain not only a healthy weight, because if you're obese, it presses on the knees, but it also reduces inflammatory conditions within your body. It improves recovery from exercise and also lowers the chances that when you get older you don't have, osteoporosis or arthritis. It sounds simple, but it is simple, right? Consume more fresh and veg and organic food, food which comes out of the soil, especially the ones which are high in vitamin C, sulfur and antioxidants here. You want to bring in leafy greens, right? Salads, kale, all the spirulina, clamac alga, chlorella, right? All this fantastic oxygenated food, carrots, peppers, all the blue colored berries. You want to have even onions, broccoli, garlic, asparagus, cabbage, all what nature provides. Bring that in. And with that, I want you to also add a higher dose of omega-3 fatty acids, which you usually get from wild-caught fish, if you still find a fish which is not filled with toxins today, or any grass-fed meat, fish, fermented dairy products even. Don't forget the plant derivative proteins here. Healthy fats, definitely important. Lubricate your joints. I like copaiba oil, which comes from the Amazon. Fantastic for synovitis and bursitis. Contact me at my practice, Medica Nova. I have a great product for that. Coconut oil, olive oil, grass-fed butter, avocado, nuts, right, seeds, all these fantastic fatty acids. And here we also want to think about collagen, which is the stuff which holds the flesh together. You can get collagen protein powders in your health food store. Look for something which contains 5 different collagens, not just one, not just the actual bone broth only. If you want to have, or if you want to do your own bone broth at home, go for it. I encourage you to do so, but you can also get a collagen rich protein powder in your health food store. Bring in more spices, right? Ginger and turmeric, which is curcumin. And of course, take away all the hydrogenated oils, the soya bean oils, the cottonseed oil, canola oil, all the cheap oils, processed refined grains. Just get away with that. Anything which creates inflammation within your body. You want to bring in supplements, and here I would say glucosamine and chondroitin is very important here, as well as turmeric. I would say turmeric 3 times a day when you have an inflamed, acute, red, swollen kneecap. Definitely great collagen, I mentioned, and omega-3 fatty acids. But today I also want to talk about a large range of homeopathic remedies, all you can get in your health food store. I'm not going to go into something complicated. The idea is here that you find your individual expression of your symptoms and match them with the homeopathic remedies, which I share with you in a minute. That's really the core here, and we'll go into detail, and you can do that too. So in an acute phase, let's say you have an accident, right? You fell on your knees. It's not arthritis. You fell on your knee and it's black and blue and you have a really hard time. Go in your health food store and get yourself the homeopathic remedy Arnica Montana 200. In this case, I want you to have 200. Right? And here I'm talking about adults, not children. I want you to take one tablet every 1 to 2 hours for the first day. If there is bursitis involved, that means this little sac filled with liquid, then you maybe want to follow it up with Apis 30, it's made from the bee, 1 tablet, I would say every 1 to 2 hours, maybe for 1 or 2 days. If you're in doubt, contact me at help@medicanova.net. I'm happy to help, or your personal health care practitioner. But that should take away the swelling and the bruising. If you have more chronic situation where you need chronic care and you really don't know what that is, right? Could be arthritis, but you don't know, you never really had a test done. There is a protocol which sort of is generalized and could work very well for you. There's a remedy called RUTA, GRAVEOLENS, or RUTA, and I would like you to get 6C, that's the potency, that's the number behind the name of the product, 6C, and you take 1 tablet morning and evening. By the way, how you take them, you put them on your tongue, and about 10-15 minutes before and after you take the remedies, do not eat and drink. Just let it dissolve under your tongue so it goes straight into your bloodstream. I also want you to get some biochemic homeopathic cell salts or tissue salts, they're called in Europe. Remember a few weeks ago I made some videos about the biochemic homeopathic cell salts? Well, we bring them in again in a really good way. So I want you to get 3 of them. They're called FLUOR, SILICEA and FHOS. And you take all 3 of them, 2 tablets, 3 times a day of each product, but you take it apart from the RUTA. So the RUTA only morning and evening, and the FLUOR, SILICEA and FHOS 3 times a day. And you do this for a month. Then after, you go into the 2nd month, I want you to increase the potency of RUTA to 12C. Maybe you have to get it online or in a homeopathic pharmacy, you get hold of it. And continue with your FLUOR, SILICEA and FHOS. And then a month later, you maybe add up the strengths again and take RUTA 30, which you would get in a health food store. Again, continue with your biochemic homeopathic cell salts again. So you've heard 3 months protocol and see how that works. You maybe even can heal your carpal tunnel syndrome with it if you have one on top of it. RUTA is really, really good for that. And as I said, if you're in doubt, contact me at help@medicanova.net. So let's go into the main remedies now in more detail and see if there's one remedy which gives you the feeling, that sounds like me. Maybe I'm going to try this out. The first one is called RHUS or RHUS TOXICODENDRON. Difficult name, but just look for RHUS. And RHUS is the best for knee joint with a tearing pain. There may be a swelling around the kneecap, definitely a marked stiffness, right? That gives it away. Pain in the joint is more marked when getting up from a sitting position and gets better by walking, continued movement, or by application of heat on the affected part. It's probably the major remedy for arthritis with elderly and knee pain. The patient gets knee pain on going up the stairs, sitting down, right? The affected part even gets paralyzed, right? And they cannot tolerate any cold air, or when the weather changes and it gets more wet, definitely more remedy indicated for the UK. I lived there for nearly 20 years, so I know it well. You get arthritis, for free because it's so damp and wet out there. So RUS is a good remedy. Stiffness. It's like you get up from a chair and oh my God, it's so painful, but continued movement makes it a little bit better, only for the pain to return. Mentally, emotionally, the person often feels very stuck in one's life, right? They can't move forward, like what I told before. It's like the knee can't move forward, right? And you then see that the actual physical complaint of not being able to move forward then becomes the entity, the enemy. Oh, my life would be so much better if I didn't have that knee pain, right? But what's really going on with your life? I already mentioned RUTA graveolens, RUTA 30. Definitely effective for osteoarthritis in the knee joint, where the patient feels the knee gives away. Okay? I mentioned that before, while ascending or descending stairs. Pains very deep in the long bones, they must walk about. And the pain gets better by applying pressure, massage on the affected part, but the thighs even feel broken, and it's worse for stretching the legs. With RUS, just want to mention that the people also have restless leg syndrome in the night. Could maybe heal that too at the same time. A lovely remedy I also want to mention here is called BRYONIA, which is opposite to RUS in terms of its symptomatology. It's again osteoarthritis of the knee joint, but here again the joint becomes very red, swollen, hot. There can be a stitching pain, tearing, and it's worse on the least movement. And that's different than from RUS. RUS is you get up from the chair, stiffness, really painful, but then continued movement makes it better. With BRYONIA, it's every movement makes it worse. So they have to lie in bed, put up their legs, really be still. That's the only thing which makes it better. They even totter a little bit, the knees totter, right? They sort of shake a little bit and bend under him when walking. The patient feels like even a cracking sound while walking. And again, the leading symptom here is when the pain gets really strong by walking or any movement, and better by complete rest. We talk about knee pain and arthritis, but each person experiences one's pain in a very individual way. And that's why I'm here to show you that. Now, if you know of anybody who's obese, right, and puts a lot of weight on the knee, you maybe think about a remedy, CALCAREA CARBONICA or CARBONICUM 30. Again, osteoarthritis is worse on exposure to cold weather. There's a tearing pain in the muscle. The pain and the swelling of the joint gets worse when getting up from a position or by walking. So it's similar to RUS, but here the person is obese. They have a very sweaty knee even. The feet and the hand are cold and clammy. They sweat easily, and they have strong cramps in the calves, particularly at night or when stretching out the leg at night. So that gives it away with the remedy. They also get easily cold. They even have to wear socks in the bed. Another very rigid remedy, mentally, emotionally, as well as physically, is called CAUSTICUM. All these remedies you can get in your health food store, right? So it's not too heady here. But in CAUSTICUM, we see arthritic pain of the knee. There can be cracking, right? Tension in the knee. But here the stiffness is in the hollow of the knee. So it's behind the kneecap, right? The back of the knee. This is the hollow. There's tearing pain in the knee, which gets better from heat and worse by exposure to cold air. And the patient experienced burning in the knee joint. Again, unsteady walk, right? Easily falling due to pain and stiffness. Again, big stiffness here. But mentally and emotionally, the person feels easily upset when it comes to injustice. Injustice about the state of the world, right? Which right now doesn't take much, right? We are all very upset about things, but this person is very, very sensitive when it comes to injustice, and particularly about the world. They want to better the world. They're political activists. They would go out and join a demonstration, right? They have a voice. They want to stand up for the group and want to, serve for the underdog. So what happens within their bodies, they become a little bit stoic. They become a little bit rigid about this whole thing. And there comes the stiffness in the knee. I'm not saying it's always that easy to relate it, but there are elements in it. The last remedy is called sulphur. Sulphur is a great remedy for any skin ailments, from psoriasis, eczema, itching skin, all of that. But it's really great for osteoarthritis of the knee when other remedies don't work. I often use it as an intercurrent remedy. Again, there's pain and swelling and stiffness and worse on standing and using stairs, which is sort of the common, right, expression. But another marked symptom here that the people often experience burning of the soles. They have very hot feet. They stick them out on bed, in the night, and they have to uncover them. They feel hot on the soles of their feet. And again, the gait is unsteady, stiffness and pain. I usually give sulphur maybe 3 times a day for 3-4 days, and then give it a break for another 4 days, and then resume again with the individual remedy, like maybe Rustox or RUTA. So that maybe works. It almost cleans the slate. Something is blocking inside you. So have a look for that. I think that's what I want to leave it today. So I suggest, other remedies you want to maybe look up is NATRUM muriaticum, silica, lycopodium, even LEDUM, palustre. But hey, let's contact your personal healthcare practitioner or contact me at health@medicanova.net and book a session. I'm happy to help here. I usually use a combination in my practice, Medica Nova, with Amazonian, Chinese and Western herbology from systemic formulas. I use them for over 20 years and they really work with the combination of homeopathic protocols. So you have the nutritional therapy, you have the diet, you have the supplements, and you have the homeopathy. It works really very well. And you see results quite soon as well. So if you require an individual natural protocol, as I said, with effective supplements, contact me at health@medicanova.net, and don't forget to have a check on my website medicanova.net for the fantastic online courses. So for today, take care, much love, and just keep moving forward, right? Don't go into submission, stand tall, be independent, step away from the crowd, walk to the own beat of your own drums. You can do it. Take care.